Okay, hi, my name is Brittany Lyons. I chose to do my PowerPoint presentation on peripheral artery disease, also known as PAD. My family is personally affected by it. My father-in-law has it pretty bad, and my husband's grandfather also had it. So it's very hereditary. And so it's something that we already kind of watch out for with my husband, being that he's in his early 30s. So it's something that I kind of already know about, and I just chose to do it just so that I could maybe understand the disease a little bit better. So this is the patho. So PAD is basically a disease where the artery walls thicken in the extremities, or the arms and legs. This causes progressive narrowing of the arteries, and this is caused by arteriosclerosis. I don't know if I'm saying that right, but basically that is when the cholesterol and the lipids are deposited into the vessels, and it creates like a plaque, and it clogs up your arteries. So this constricts blood flow, and it causes problems with the muscles. It causes problems with moving and all that kind of stuff. Why does that? And this is a picture. This right here is a normal vessel that has good blood flow, no clogging. And this one right here is when you have some plaque, and you can see how it constricts the blood flow. So it causes problems with blood getting where it needs to go. Some signs and symptoms. Some signs and symptoms of PAD would be ischemic muscle cramping, which, so I know a lot of times, like my father-in-law especially, if we're like going somewhere or walking around a lot or even going upstairs, his legs would start to cramp really bad. And then as soon as he would sit down, give it a few minutes, it would go away. So that's one of the classic signs of PAD. And it's happening because your blood can't get down there to oxygenate the muscles, so they begin to cramp up. And this is another one: burning, hardness, knotting, pressure, soreness, all in your extremities. Those are some classic signs. Some more signs and symptoms would be numbness or tingling. And if your leg is elevated, that would cause it could cause your feet and your legs to become pale. You could also have redness when your limb is just hanging because the blood can't go back up. Muscle atrophy is another one. One of my father-in-law's legs is half the size of the other one. Basically, it's just because there's no blood flow, so the muscle is becoming smaller. It's deteriorating because it doesn't have enough blood flow. So when PAD progresses, it can get to where it hurts all the time, even at rest. But then there are some people who really don't have any symptoms of PAD. They don't really know they have it until they start to have problems. Some risk factors include people above the age of 60, diabetes, high cholesterol, hypertension, hyperlipidemia, and then hereditary. If it runs in your family, you could be susceptible to getting it, along with coronary artery disease, which that kind of runs side by side a lot of the times. Knowing the statistics. In the United States, there's 8.5 million people that are affected with PAD. There's a higher prevalence of it in African Americans, but it affects both men and women equally. So if you have PAD, you are at a higher risk for having coronary artery disease or cerebral vascular disease, which would be like heart attacks and strokes. So PAD basically is diagnosed with, it's called an ankle brachial index. It's when they basically use a Doppler and they put it on your foot in your posterior tibial artery, and then they have it on your arm, and they use your brachial artery, and they do your blood pressure, and they compare the two at rest and then when you're exercising or right after you're exercising, and they compare them just to see what your blood pressures are in both. Then there's also imaging tests that they can do, which is ultrasound or magnetic resonance, or CT scans and CT angiographies. Those are all ways to diagnose PAD. And this is the ABI. That's a picture of how it's done. You can see the Doppler right here. They use the Dopplers for your posterior tibial artery and then the brachial. They use the Dopplers there, and then they take your blood pressure in both. And that's kind of how they diagnose that. Some treatment options would be like medications that you can take. It's to help blood flow, so anticoagulants a lot of times, or statins. A lot of doctors will just tell you a healthy lifestyle. Exercise is very important, a healthy diet, to quit smoking, and to manage your diabetes. Those are all treatment options. And if that doesn't work, then surgery is also an option. They can either do a stent, which they put like I believe it's like a balloon that kind of like opens up the artery so that the blood can flow. And if they can't do that, they can take a graft, which is, it's a bypass surgery where they use a vein from somewhere else in your body, and they basically bypass the part of your artery that is clogged. So they use a new vein to open up and have blood flow down to your feet and or your arms, wherever the clog was, or you know. And I know when my husband goes to the doctor, the doctors and nurse practitioners and nurses, the first question they always ask him is, do you smoke? And his answer is no, but it's very, very important not to smoke, because these are the reasons why. Smoking constricts the blood vessels, which is kind of what PAD is already doing. It's narrowing your blood vessels, so if you smoke on top of that, you're not helping your situation at all. And you know, when you quit smoking, it helps every aspect. It helps your lungs, lowers your risk of cancer. I mean, overall, it's good for your health, but it's very effective if, you know, you quit for PAD, because it can slow the progression of PAD down. And these are my references. So, that's about it. So, thank y'all for listening.